So BMI and body contouring surgery, it's important for a couple reasons. One is safety. Two is the expectation for what result we're gonna get. For tummy tuck, if we've got an elevated BMI and we have a lot of visceral internal fat, that'll cause the muscle wall just to have a restriction in being able to be flattened, and will push back out even if we do work to flatten things. So plastic surgery is not a weight loss procedure, and it won't change the amount of internal visceral fat we have. If you have a lot of significant layer of external fat, have a loose muscle wall with not a lot of internal fat, you're gonna be a great candidate because we're gonna be able to significantly thin the external layer, whether it's just with liposuction or if with extra skin, also a tummy tuck and tightening the muscle wall. So here's a patient, we're doing tummy tuck. She's got significant distension or roundedness. In this case, normal BMI, most of this is her muscle wall, and there's some external fat, but not a lot of internal fat at her normal weight and BMI or body mass index. So I'm anticipating we're gonna get significant flattening with tightening the muscle wall, and then with the loose and extra skin, tummy tuck is also gonna allow us to redrape. And she's gonna get a great result, and it's a very significant difference. Body mass index, or BMI, is a simple number calculated with height and weight, and it can be very helpful. In general, we have a BMI between 20 and 30. You're usually in a good range for plastic surgery, depending on your tissues and what your goals are. BMIs above 30 starts to be more borderline for safety reasons for healing. It's also with the result we may get at a higher BMI person. That said, there are exceptions if you're very muscular, if you're an athlete that has a strong amount of muscle, or my BMI is always a little higher, I'm more muscular and stocky. So there are some exceptions, and we're really looking at body fat, but overall, BMI is a simple, easy to calculate number that gives us a gauge of where you may be a good candidate, or if you might be at a higher level where we ask you to come down to be a good candidate for surgery. So in the case of a higher BMI and more internal or visceral fat, it will be that rounded muscle wall and rounded belly that isn't going to significantly change. Won't change with liposuction. Even with tummy tuck, we may get a very limited result. We have a significant external fat layer, we'll notice difference there, but most of the time is going to be limited in how happy we are, how much of a home run we get in supporting and flattening in that circumstance. In the case of an isolated procedure, maybe reduction of a male breast that looks enlarged and feminized, sometimes we'll go to a little bit higher BMI for that, so that's also case by case, or just focal areas, or non-body contouring procedures. So in those circumstances, reach out to us and we can give you further information.